Hello, I am Justice Rupp, and today we are going to be talking about treating complex trauma. Trauma is a term you might have heard circulating on the internet or between the whispers of your coworkers and between customers, but what does the word trauma really mean, and how can an overwhelming event turn into complex trauma? Today, I have invited Teresa Bennett, who has her Master of Science in Clinical Counseling and licensed professional counselor, and has been practicing mental health in Boise, Idaho for 9 years to help us understand the impact of complex trauma. To first have an understanding of trauma and complex trauma, Teresa will define the difference between them.
So trauma is subjective to each individual. Everyone's own personal experience and feelings can determine whether something might be traumatic to one person and not the other. Trauma is a result from a single incident, whereas complex or chronic trauma is repeated and prolonged exposure to trauma. So complex trauma is exposure to various and multiple traumatic events, often of an invasive or interpersonal nature.
Everyone in their life will most likely experience a traumatic event. However, when a traumatic event becomes repetitive or prolonged, it can cause complex trauma, which leads to the interruption of daily life tasks. An example of symptoms for complex trauma, according to the Cleveland Clinic, includes anxiety, digestive issues, trouble sleeping, heightened emotional responses, depression, addiction, self-harm, persistent difficulties sustaining relationships, and more. Through my research, I have found that there is an extensive list of physical and mental symptoms that someone could experience from complex trauma, which persists and tend to get worse over time without seeking professional help. Often these symptoms caused by complex trauma are misdiagnosed as other mental health disorders such as borderline personality disorder, depression, anxiety, dissociative identity disorder, and others. This can make it difficult to get the correct treatment for complex trauma. However, there are many different treatments that can help those with complex trauma. While complex trauma isn't something that is necessarily diagnosed, it can lead to the diagnosis of other mental health disorders. While there is a variety of treatments for complex trauma, for today's episode, we're only going to be talking about a few treatments that have had the most research done on them and have been shown to be the most effective thus far, as well as a few treatments Teresa Bennett will also talk about. A great source for discussing the very wide, extensive list of treatments for any level of trauma is called The Body Keeps the Score: Brain, Mind, and Body in the Healing of Trauma by Bessel van der Kolk. This is a really wonderful book, and I highly recommend it to anyone interested in topics of healing trauma. A vast majority of sources I have also researched included references to this book. So what is the best treatment for complex trauma?
I would say that there is no best treatment for trauma. It's really subjective to each individual. But many mental health therapists have undergone training with different treatments. There are also many different specialties that are specific to helping those with complex trauma or any trauma overall. In my personal practice, I love using mindfulness techniques as a starting point for most patients. I find that it's really important to allow those with such dysregulated nervous systems to start to find a way to look inward within themselves and learn to feel safe within their own body. I also find that this is a great foundation before going into deeper treatments because it gives my patients something that they can carry on with them outside of my office, and it's something they can also go back to. But those within the complex trauma often dissociate, so finding a way to stay grounded during more intense treatment is pretty vital. EDMR is something I use within my practice and have actually done myself. It's a great way to process traumatic events, especially those with PTSD, PTSD, and many other disorders that accompany complex traumas.
Let's break down and explain a few terms Teresa used that I also found information about within my research. The term EMDR therapy was one of the most popular treatments I found, which is probably because it's the most tested treatments for trauma. EMDR stands for Eye Movement Desensitization Reprocessing Therapy. Within the article by Restorative Counseling, they say EMDR is different than most talk therapies. It does not require a person to explain their trauma in detail. Instead, a person will do a bilateral eye movement or tapping while focusing on an image related to trauma. EMDR therapy helps a person become, quote-unquote, unstuck so their brain can go through the natural healing process. It is designed to help a person quickly resolve traumatic memories. Unlike other therapies, there is no focus on changing emotions, thoughts, or behaviors related to the trauma. Often, EMDR therapy can be completed in far fewer sessions than other talk therapies. Many studies have been conducted on EMDR therapy with a success rate of ranging between 70 to 90% of people with less symptoms. Now let's continue to hear about some other treatments.
Somatic breathwork is also a practice I love implementing. It isn't so much about talking about your feelings, but instead it's about allowing your emotions to be released through your body with your breath, as well as some other special treatments.
I also found information on the success of somatic breathwork in my research and wanted to discuss this. Somatic breathwork uses your breath to regulate your nervous system and restore or release trauma within your body. Talk therapy has been shown to be less successful for those with complex trauma and may even re-traumatize an individual. Since those with complex trauma have undergone prolonged or extensive traumatic events, it can often take more than one treatment. I did find that complex trauma isn't really something that someone grows out of or gets over. It's more about emotions that you have to go through and move through, and it's highly encouraged to see a professional when looking for help. Another treatment I found within my research that hasn't been mentioned yet is cognitive behavioral therapy, also known as CBT. The Cleveland Clinic states that therapists use exposure therapy for people who have PTSD and CPTSD. Exposure therapy slowly encourages them to enter situations that cause them anxiety and try and stay in that situation so that way they can learn to cope. This treatment focuses on addressing the distressing and often problematic thoughts and emotions that have developed since the traumatic events. This type of treatment has undergone multiple studies and has a success rate of about 50 to 70% of the lessened symptoms. I will note that with these studies that have higher success rates, the long-term effectiveness is mostly unknown. Another treatment I want to mention is medication. Medication has been shown to help for periods of time, especially in triggering situations, but it isn't helpful for reducing one's long-term reactiveness. It can be helpful in conjunction with other treatments. The last treatment I want to mention that I find personally to be the most interesting is neurofeedback therapy. This type of treatment is different than others listed because it isn't used by professional therapists but by a clinician. This type of therapy doesn't require talking about trauma like before. It's instead literally rewiring your brain. Complex Trauma Resources states that neurofeedback decreases trauma-based symptoms and improves executive functioning through directly accessing the brain through non-invasive monitors of the frequency of various brainwaves. This is accomplished through the use of EEG monitors, which tracks the brain signals. Clients are taught techniques such as breathing, which regulates brain activity. As the client effectively focuses and regulates achieving the desired goal for change, they are rewarded with a visual or auditory reward. These rewards let the brain know that the regulated state is the desired outcome. With repetitive exercise, brain networks are reshaped for improving functioning. Neurofeedback has been shown to increase attention, improve mood, the ability to learn, and improve other behaviors. It rewires the neurons within your brain. This type of therapy has been shown to work long-term, however, patients may need a few refreshing sessions if their symptoms begin to reappear. Now that we have discussed a few treatments, can someone with complex trauma be treated with a full recovery into normal functioning life?
Trauma isn't really something that we cure. Different treatments have shown to have huge success in reducing a person's reactivity to triggers, which has allowed people to live a functioning life for sure. But often with complex trauma, there are so many layers of healing that need to happen with the help of a professional, and people aren't cured, but with help, they learn to be able to manage their emotions and reactions. And it really helps the individuals with complex trauma to function in society. But it does take a lot of work on their part and on our part to work together. But the journey is definitely worth it, and that people can definitely find a way to function.
Now that we've talked about symptoms and treatments, what are resources that can help someone looking for help in treatment for complex trauma?
Great question. It is important to talk about this issue, and for those who feel like they relate to this topic, it's vital that they are pointed in the right direction for help. You're not alone in this. Psychology Today contains a section where you can find a therapist near you, and you're also able to see if there are therapists who specialize in what you're looking for. One called complextrauma.org is also a great site for grasping a better understanding of what complex trauma even is and if you might have it. I do think the most important part of someone's healing journey is asking for help, and it is important to know where to ask.
I would like to reiterate that if you or someone you know may be struggling with the effects of trauma, there are so many professionals out there willing to help you, and seeking help is the first step. I hope this helped you learn a little bit more about complex trauma and treatments that can help with it. Thank you so much for listening.